operating right now that we're going to be talking about monitoring for, and it's the opioid project, and then the two recent ones, the COVID disaster recovery and the COVID employment recovery. So we've got all of the LWIAs on the phone that are administering those projects. Today we're going to discuss our plans for monitoring and technical assistance related to monitoring. John Barr is going to be our presenter today, and he's going to be going through the PowerPoint that you all received. Let me mention that I also sent out in today's email 2 other documents. Not that we're going to go over those today, but I did want to let you have them, which you may already have, but I just wanted to put those back in front of you. Those are the DOL's core monitoring guide from 2018, but then I also included DOL's old WIA NEG National Emergency Grant Monitoring Instrument. I was hoping to have gotten you their new updated WIOA version of the document. Going back to August, they were hoping to have it ready. It's not ready yet. So we thought in the meantime, we'd share with you what they put together years ago for the NEG, because what they're going to put together this next time, it might, be very similar. So anyway, those 2 documents were also attached to your email today, and we're not going to go through those, but please, take a look at those and have them handy. As I said, John Barr is going to be our presenter today, but we're also joined by Deb Waltrip, who's assisting us with the DWG monitoring efforts in TA, which I am absolutely thrilled about. Most of you know Deb. She retired from DCEO, and she retired from as being regional manager of the Southern region. And like I said, most of you know her from monitoring from, days past. Anyway, so we're thrilled to have Deb as part of the team and helping with these DWG grants. Deb and I are both going to be joining in periodically to provide any additional input, answer questions, that type of thing. Tammy's out of the office today, so she's not going to be joining us, but she has been involved in the monitoring and TA discussion. So feel free next week when she's back, if you need to reach out to her, feel free to do that. She'll be available next week. So anyway, at this point, that's all I wanted to say in kind of opening things up. I'll turn it over to John now. So thanks again, everybody, for joining us. We greatly appreciate it. John?
Great. Thanks, Jill, and thanks, everybody. Good afternoon. I'm going to try to share my screen here, and we'll go through the slide deck, and then we should have plenty of time for questions. And just to confirm, can you all see the slides, and can you all hear me okay?
Yes.
All right, excellent. Yep. Thank you very much. So, the reason why, we're having this discussion, and I appreciate the opportunity from Jill to use this time that, she had with the DWG grantees to, really emphasize the monitoring and risk management of these grants. I think as we've talked in other venues, U.S. Department of Labor, has indicated that there's a, pretty bright spotlight on these DWG grants, and we want to work in cooperation with you at the local level, the regional local level, to manage the risk and to develop successful projects. And so that's kind of the context that we're in today. So go ahead and just talk about the agenda for today. Just give a little bit of a background. Talk again about some of our risk management strategies. We'll talk about our compliance monitoring, and especially the areas of emphasis, and we'll have Q&A at the end. If anybody has any burning question as we go along, please jump in, and we'll address those questions. As I mentioned, the DWGs are very high profile As you all know, they are the some of the only specific funds that the Title I, pushed out as part of the COVID response. And so on the Employment and Training Administration side of DOL, there is a high level of emphasis on these grants and an emphasis around getting these up and running and enrollment expenditures and so as Jill mentioned, we are also we have the ongoing opioid disaster recovery projects that we'd also like to incorporate into this effort, because a lot of those same issues that we're going to address with the opioid are relevant with the COVID disaster recovery, especially as we get into those disaster recovery employees and those types of considerations. So on the screen here, you just see a list of all the areas that currently have those projects. Allowable services. So as y'all probably know, USDOL came out with an updated TGL and guidance around the allowable service under the DWGs, outlined the career training and supportive services. One of the newer services or one that they clarified was the disaster recovery services, and including disaster relief and employment, safety training, and supportive services. Wanted to emphasize on the next slide just around the disaster relief employment side. Disaster recovery grants, and so that includes both the opioid disaster recovery as well as the COVID disaster recovery, includes an option for temporary employment for projects for disaster recovery activities, right? So it has to be directly related to supporting the disaster recovery efforts. And that's really a key point. And that's one that, every time that Jill and I and Tammy talk to DOL, there is an area of emphasis around making sure that projects are not focused around just kind of ongoing operations, and that the occupations or activities and work sites are, focused on either on the opioid side, addressing the opioid crisis, or on the COVID side, addressing some type of COVID relief, be it direct COVID sanitation or humanitarian aid that is a result of the COVID health crisis. And Jill, I don't know if you want to add anything to that point.
Thanks, John. Yeah, many of you who have done disaster projects before, they've generally been for flood, tornadoes, that type of thing. So with these, the opioid and the COVID project, these are basically, they're pretty much humanitarian efforts. And recently, in the last 5-10 years or so with disaster projects, we really have been more focused on cleanup, flood cleanup, tornado cleanup. So this is something new. No, I shouldn't say it's new, but it's a different emphasis this time on the opioid and COVID projects. And yes, I do want to emphasize, and I know everybody's probably tired of hearing from me on this, but always emphasizing that every one of these work sites, every one of the jobs that's carried out has to be shown to be related to impacting the disaster. And that's why we've talked about with your worksite agreements, making sure that it's clear that it's related to impacting the disaster, your job descriptions, the orientation sessions. So when anybody talks to a participant, a supervisor, that everybody's on board, everybody's on the same page and knows exactly why the work is being done. And it isn't for ongoing operational needs. It's got something to do with impacting COVID in terms of most of this is really mitigation efforts, trying to slow the spread, stop the spread, keep people safe and healthy. That's mostly what's going on with the COVID, or with the opioid project, again, that all of those work sites, all of those job tasks are tied to impacting the opioid crisis. So thanks, John, for the opportunity, but it's something that in monitoring and the TA, we're going to continue to have ongoing discussions. So just make sure that you and your staff, everybody, all the staff, are again reminded and are constantly aware of the importance of this component. Thank you.
Yeah. Thanks, Joe. And again, I think as we look at this from a risk management lens, this is certainly, especially with the costs and the budgeted costs that are in the grants for disaster relief employment. If you potentially, if you had a work site that was identified by DOL as and they make a ruling that it's not COVID related, that's we seriously are opened up for some potential question costs, and so that's something that we absolutely want to avoid. And so I think definitely continue to work with Jill on the establishments, and Jill and Tammy on the establishment of those work sites to make sure that that we're on solid ground. And certainly if there is a question and there is gray area, then let's get a kind of a predetermination working with the DOL regional office. And I understand that that can it's sometimes delay a project, but again, just big picture wise, just from a risk management standpoint, I think that is the prudent way to go. Better to have a solid work site than to have a question cost. Okay. As we're talking, just as far as risk management plans, so this is the initial slides are kind of a setup to, here's the background, which I think you're all generally aware of. And so as the state looks at, what is our rollout plan? How are we, looking to approach these grants? I think that our risk management plan has already started, right? And that was with working with you and your teams, and working with Jill and Tammy to develop the grants, develop the work sites and the work plans. And we understand that some of those continue to be solidified. The next phase that we're, I guess, rolling out today is our plans to provide some technical assistance, working, as Jill mentioned, with Deb Waldrop and in conjunction with Jill and Tammy. And I know also Annie Dorr and Brian Ellis are on the line, from a regional operations management. We definitely see these grants as, very important, and our goal is not to, duplicate things that we're already, that we already have underway, but to, kind of share the information across our units. So that's kind of what our approach is going to be. Deb will really be the point person on kind of coordinating a more formalized technical assistance, but as mentioned, working directly with Jill and Tammy and Annie and Brian is needed. Technical assistance will look at most of or all of the elements that we would look at during a monitoring. And the whole point of technical assistance is to identify any areas of concern and to address those immediately. So it is a review without the formality as it relates to, there's no entrance letters or findings letter. We may give you a summary email that kind of outlines the any areas of concern. But our goal is to work with you to identify and update and correct any issues, before they become a more serious issue and concern. And then we will show DOL that we are completing our compliance monitoring of these grants as required. Our plan is to integrate the DWGs into our formal monitoring, and I think all the areas have the timing of your annual visit. As I look at kind of a spreadsheet of all of the different areas that have the different DWGs, the timing that I have listed out here on this slide works out pretty well. There are a couple of outliers. I know, Susan, and we attend. I know that you're coming up a little bit quicker than is outlined here as far as technical assistance. And there may be another outlier or two, but generally speaking, for the kind of the TA and the compliance monitoring, this is kind of the progression that we're following. And Susan will work with you, again, as part of the compliance monitoring coming up. So we're all kind of on the same page there, and we can talk offline about that. Some of our risk factors, I think y'all have seen this slide in other presentations, or you may have. We use the standard set of risk factors, the state's Grant Accountability Transparency Act risk factors. We look and work with Jill and Tammy and just look at how complex is your grant. We'll look at what is your previous performance with some of the non-formula grants. Are you a quick starter? Are you maybe a little bit more slower of a start in running projects? We'll look at disaster, especially the disaster recovery employment. Again, this is just an area where we see some potential significant risks. Just making sure that all of our all of the factors are established to maintain compliance, right? So we'll be looking at the number and types of subrecipients. Are those subrecipients your subrecipients, right? Are those nonprofit organizations? Are they governmental entities? We'll look at where your work sites are, number of work sites. We'll look at the occupations, and that will all help us to determine kind of the priority of our reviews as it relates to the technical assistance and how much detail is included in that technical assistance review. Again, some of the highlighted factors that we will be looking at in both the technical assistance and monitoring come out of that core monitoring guide, that supplement that Jill sent out. And we actually did, as Jill mentioned, we asked Region 5, just as early as yesterday, hey, any updates or any areas of emphasis, and they were somewhat reluctant to provide that before they issue the final document. But again, I think we're looking at some pretty straightforward items that, based on over the last 5 years or so, what USDOL has looked at and had their focus on is around the service design, and did you develop your projects and grants? Does that align with the funding announcement, right? So the opioid DWG had a TEAGL that outlined the goals and objectives of that, and certainly also with the COVID the question is, how does it align? How does it, address the issues around the disaster? Allowable costs, those two kind of go hand in hand, right? Making sure that there is a direct connection to the disaster. Looking at those participant eligibility items, as you know, there are some additional flexibilities that are provided for disaster recovery employees, but there still are those. They have to meet those long-term unemployed criteria. DOL will look for case management for those individuals in a DWG where those individuals are receiving career services or receiving training services. So if they're enrolled, they will look for full case management. And those local areas that have had a DOL review, they understand the depth at which the monitors will review participants' case file, right? They will want to make sure that a case manager is connecting all of the dots as it relates to that individual's assessment to the decision to put them into a training program and to assure that that training program is suitable, and that also that the case manager has made the appropriate referrals and has offered the appropriate supportive services for that participant to be successful in that training program. Another piece that they will look at, those temporary jobs, obviously, to hammer that point that they will look at that direct connection to the disaster, making sure that they all of the requirements of the temporary jobs components are met, and we'll talk about some of those in a slide coming up. They'll obviously look at your service goals, right? What are your planned versus your actual goals, and they'll look at that. They'll look at the state, and then they look individually at the grant. They'll want to look at the performance outcomes. So, what are the those individuals that are getting those career and training services? Are they appropriately on a path to be successful as it relates to successful performance outcomes? And the next slide just talks about just some of the key administrative and fiscal items, and these are fairly straightforward, right? That you have proper internal controls, that if you do have any, especially if you've had any, if a temporary service was utilized for the employer of record, that you went through your correct procurement procedures. Also, as it relates to internal controls, that if you are the employer of record, that you have proper procedures as it relates to documenting the hours of your workers to ensure that you're making proper payments, and that you have support of those payments. If you are using a subcontractor or a vendor, a subrecipient or a vendor, to provide that employment of record, that you are monitoring those activities, and that at the point that you establish that contract, that you have a solid understanding of their internal policies and procedures as it relates to supporting documents around workers and worker payments. Just some foundational components that, again, most of the local areas who have run these projects and who run either paid work experience or OJTs, have processes in place. But again, pulling this right out of the DOL's DWG or the NEG supplement. So this next slide talks about just our areas. This is as we think about what are the biggest areas of risk for these grants. This kind of hits on many of them, especially for those individuals on work sites. We want to make sure that the work site is safe. It is a suitable work site. It has supervision. We want to ensure that there is kind of control mechanisms to make sure that employees are, especially in the age of COVID, right? If they are out in the community, that they have their proper health and safety training, that they have proper safety equipment, if that is, masks or other personal protective gear, just like they would if they were on a flood cleanup site. Steel-toe boots, replace that with masks and gowns and other PPE. I mentioned, just as it relates to documenting that everyone is on the same page, right? And so that's really what these first couple of bullet points get to, as it relates to the assessing the work site to make sure that it is a suitable work site, and that there is supervision, that there is safety, and that the individual who you're placing there, that it's a right fit. Also to document that expectations around the work site agreements. And then obviously as you go through and the worker performs their duties, to make sure that they have an understanding of the timekeeping and the payment procedures, and that you have all of your documentation in place. And then obviously that you have monitoring procedures to address the issues and concerns immediately as they come up, and to make corrective action. So we expect you to be in pretty constant contact, especially at the outset for these work sites, to make sure that things are established correctly, and that things are on track, and then that you maintain that contact, both with your worksite supervisors and also your workers, to make sure that there's no issues. And then finally on this, if there are issues, just a reminder that if there are issues that raise to the point of an incident, that our expectation is that you inform DCEO immediately when something comes up. We have an obligation also to inform DOL, and they're as I said, they're very very interested and concerned about any issues that may arise from these DWG grants. Couple of resources, which I think you already have. One is the workNet DWG, DOL, and then Workforce GPS has a lot of good different forms, but I understand that most of you have kind of local forms as far as worksite agreements. And Jill, I know you had mentioned that you had shared some worksite agreements and other templates, and we want to definitely share, if your area doesn't have an updated agreement, or if you're looking to update yours, we definitely want to share best practices across local areas. One of the places where I think Jill was we were talking about updating was on the workNet site. In that, if you go to that illinoisworknet.com/DWG, and I'm going to just try to share that screen just so you can, I know y'all have seen it, but I'll just show you a place where, so this is just worknet.com/DWG, and if you scroll down here, you can see kind of the overview, and over here there's some resources, and some of these resources now point to the the federal regs around the that just were updated, just around the use of the national emergency grants, or the new DWGs. And so Jill and Tammy are going to work to post some additional information, probably both here and perhaps in other places. I know we're working out the logistics on that. So we're just about at the end of the slide deck here. And we actually are at the end here, and I see Deb right on looks like you're in, but we're having some audio trouble. I know we were having that same issue on some previous calls with other folks today, that kind of concludes the formal piece of the slides. And Jill, I don't know, is there anything that you want to add or emphasize to that?
At this moment, I don't have anything. Although I remember from when we were meeting yesterday, I made a couple of notes and I'm not finding that particular page. So no, but I guess, yes, let me add to what John was just talking about. I know we've been talking to all of the grantees, Tammy and I in particular, the COVID ones recently, about sharing some forms. So John's right, we're needing to get those organized so they can be posted to WorkNet in an easy way to access them in terms of them making sense, because we don't have standardized forms, and except the worksite agreement, at least for the COVID, is fairly uniform. Pretty much everybody's using the same one. But if it's timesheets or orientation sessions or whatever the forms are, everybody's pretty much on their own. So we thought we'd share that, and you can take a look at that and see if that gives you any ideas. Plus, it may give you some ideas as to what you're not even using yet, but you're thinking, well, maybe that's a good idea. The one thing I do want to stress in terms of forms, a couple things, is orientation, participant orientation, supervisor orientation. Those are critical. And they do need to be thorough in terms of addressing the various things. So I wanted to stress that. And then safety program. As you know, we talked about this recently, every single participant in disaster relief employment does have to have safety training. We haven't mandated as a state what that looks like. We have left that up to each of the grantees. But each of you do need to have a program, if it's at each work site or if it's something you're doing as part of orientation. Again, we haven't mandated what it looks like, but be sure that every participant gets that up front and that it's documented. We'll probably be talking more about the safety program because that is such an important thing, and I know DL is going to be interested in it. But anyway, those are the main things I wanted to stress, is the orientation and the safety program. Thanks, John.
Great. So, David, I don't know if you could unmute everybody maybe, and we could see if there's anybody who has any questions. I don't see any questions in the chat at this point.
This is Blanche. I do have a question. I wanted to talk a little bit about case management as it relates to temporary employment, because my understanding is that the case management that we do for training of participants that are in training, that's a different kind of case management. That's the thorough case management you were describing. But for those individuals that are only going to be in temporary employment, we're not actually conducting case management, but we are tracking their progress and maintaining contact with them, just so we know what's going on. So I just wanted to clarify my understanding of how we're supposed to tag that or categorize that, because it's not, I thought it was not supposed to be considered, quote, case management.
Blanche,
Yeah.
with talking about the case management in the training, you're talking about disaster relief employment, the temporary jobs, and you're talking about safety training. Are you talking about skills training so they can carry out the temporary job? Or are you talking about, go ahead.
I'm talking about how we are required, we at least monthly have contact and document that in IWDs, that we have special progress reports. There's an ongoing connection that we have that we all think of as case management with individuals that are participants. But temporary workers, they don't have a training plan. They have an employment plan because they're not in training. So how we document that we are tracking progress, that we're working with them for the plan, what's going to happen after temporary employment, that things are working out at the work site, all those key things that we do, we're tracking that progress and activity. But I was under the impression that we wouldn't call that case management and they wouldn't be enrolled in case management because they're technically not a participant in training. They're a temporary worker.
Okay, let me answer it this way and we'll see if this addresses things. And I'm going to be kind of broad to start out with because we got a lot of people in the call who summer employment, DWGs. So to let you know, what I'm talking about in answering the question is only for disaster projects. So that does talk about opioid and now COVID. Something that has come out that we're dealing with fairly recently is the fact that DOL, for performance, if you have a participant who's only getting disaster relief employment, they're not going on to get the career services training, work-based training, they're not getting all of that. They're just doing disaster relief employment. So we call that DRE only. So if you have a participant that's DRE only, then they could be excluded from performance. They would be excluded from performance. So in order for IWDs, we made changes recently to accommodate that, to be able for us and you to show that. And when we run the reports and do the reporting to DOL, it's clear that a participant is DRE only. So we utilized DOL's categories, and that's why that new one is on there that John just highlighted, Disaster Recovery Services. DOL has given us 3 categories: disaster relief employment, DRE safety training, and DRE supportive services. That's it. So if you were to go ahead, let's say you have somebody who's a participant and everybody knows up front, all they want is this job, and no, they don't want help finding permanent employment afterwards. They're in it at the beginning, DRE only. So what we've been advising people to do is, if that's the case, then as you're working with someone, you only use these 3 categories in terms of IWDs services, and you don't use case management or any other career services or any training services, because that would put the person in performance. So because we can't do that, we have instructed you to use case notes. And so in the case notes is where you would document those kinds of activities and interactions. So for example, if at the very beginning you're talking with someone and you're not doing the full IEP development, but you do have to talk to them to find out what their skills are, what their interests are, so you can match them up to a temporary job. And you also need to find out what their supportive services needs are. So you do need to have an assessment, but it's not the full-blown IEP and training, testing, and all of that. So yes, you would use case management notes to document all your interactions. And so if that's your, weekly check-in, monthly check-in, whatever it is you're doing, be sure to document. And I'll have to be honest, this is new to us. We're just doing this, and maybe 6 months down the road, we'll have additional guidance and we'll find out, where maybe some gaps are. But to start out, that is what we're instructing people to do, is to use these 3 categories and then have case notes that talk about maybe even some of the pre-enrollment activities. If somebody's getting a drug screening, background check, it's a case note. Anything that you're doing with these clients that don't fall into one of those 3 service categories would be a case note and then documented. Now, just to point out that when you're starting with a participant, you may not know exactly what's going to happen with them. For example, you might think they're going to be DRE only. That's the plan. They don't have an interest. But 6 months down the road, for whatever reason, maybe their job they thought they were going to go back to, or whatever their plans are, fell through. And so now in 6 months, they're saying, you know what, I really do need training. I want your help. So you may have started out with DRE only, and they were just getting those limited services listed there. But down the road, you can enroll them as you normally do in career training, work-based training, everything. You can do that. I just wanted to point out the fact that it's evolving. Your relationship with that client, their interest in services can change. So the bottom line goal is for each and every participant, we do want to help them obtain permanent employment at the end of this project. But we will have some people who don't want our help. And that's fine, but we still need to reach out and try to assist them and offer that. If they turn it down, that's fine. But the goal is to help people obtain permanent employment. Blanche, does that answer your question?
I just wanted to be really clear in defining the difference between case notes and what I'm calling detailed case management. So it could just be verbiage on my end, but I just wanted to be really clear that there's a different expectation for tracking the progress of temporary workers only. And that's been clearly explained. Thank you.
Okay, thanks, Blanche.
Yeah, and again, and thanks for that question. That was great. And I would just say to follow up, as we look at, especially, from on the opioid side and the employment recovery grant side, if a decision is made, to put an individual into training, that connection around, as Jill mentioned, that assessment and that IEP and that the decision to invest is, as we say, invest the dollars into a training program for an individual, that's all based on the suitability of that training and the skills of the job seeker. So really good question.
Let me jump back in on this since we were talking about these disaster recovery services and make sure we use these codes. IWDs was just built out for this. So, we're all new to this. So I do want to make sure you stress to your staff to look for these. It is under disaster recovery services, and those are the 3 things. I've been looking at some of the IWDs entries, and I do want to point out that every single participant in disaster relief employment does need to have safety training. So I was seeing a lot of people without that activity code. I don't know what the situation is, but I did want to, since we've got everybody on the call here, is to stress that every participant should have that code because they should be getting that service. And when we talk about safety training, I think I just saw in the chat a question about this. What we're talking about is, because it's a COVID project, we are expecting that all the participants would be receiving some type of COVID health and safety training in terms of procedures, practices, equipment, protocols, that kind of thing. Again, we're not mandating what that looks like, and maybe that will change, I don't know. But at this point, we're looking, to you at the local level to come up with something. It's very important. We don't want our people on our work sites to start getting sick. We of course wouldn't know if it was due to the work site or some other interaction with someone. But my point is that the COVID health and safety training is critical. It needs to be done up front, and periodically would be good as far as reminders or any updates and new protocols. As far as other kinds of training, if you have someone who is doing a particular job and maybe they are using heavy equipment or something not related to COVID, it's just part of their job, then yes, they would need training related to that. And so that should be noted too. So when we talk about safety training, it's really generic. If it's a flood project, tornado, or humanitarian assistance, everybody needs to be trained in the appropriate way in terms of, by appropriate, I mean if it's COVID training or if it's equipment training, whatever it might be. And that should be documented by using that service code, and then you could make a case note too.
Jill, this is
And also just real quick, supportive services. You'll see the DRE supportive services. Anybody in DRE, and you're providing, for example, transportation, childcare, work clothing, supplies, tools, whatever it is, if they're in disaster relief employment, be sure to use that code. Don't use the regular supportive services code for transportation, for example. Use the DRE transportation. Thank you. Okay, Susan, sorry.
No, I just had a question about, for the opioid grant, is the safety training COVID safety related? I mean, we have people who are recovery coaches, so they're not out, running shovels or picking up branches or anything like that. Is that what you're envisioning for that grant?
I would say probably. I mean, I think as Jill mentioned, to the occupation, right? So if they're a counselor, perhaps that safety, think very broadly, right? I mean, it maybe right now interactions that is appropriate as far as normal social distance and that type of safety training, but perhaps that training should be around confidentiality, training around protection of PII and those types of things. So it really is going to go toward the occupation and the duties that they're going to perform, right? So if you had, if they were, delivering meals, it would, you could say, okay, well, food service safety and those types of things. So it's really, as Jill mentioned, very broad and should be grounded in, what are those core things that an individual is going to need to know to perform their duties safely.
And this is Lisa Shavak in OEA 6, and our disaster relief employment is all contact tracing, and everybody's working 100% remotely. So I had inquired about this back in August regarding the safety training, and at that time I was told that it doesn't really fit as far as safety training since people are just working in their homes. So we haven't been enrolling anybody in safety training per se. Now, that being said, all of the hires go through an orientation and onboarding process with the work site, which is the health department, that would cover things like you're saying, John, like PII and every other detail of doing the job. It's not really safety per se, but so to clarify, has that guidance changed then from what I was told in August about the safety training?
Lisa, this is Jill. That would have been me that communicated with you about that. And, we do have 2 projects that are contact tracing, and I believe 100% remote, that they don't need to meet with clients or go to in-person training. So yes, that was the guidance that I had given, but with what John is saying, that makes sense. And I like that as far as showing under safety training, maybe some of that training that you're talking about that LWIA 1 would have been doing too, probably as far as the, protection of data, that type of thing. So yeah, I like that. I like that response. And you know, being able to document that and put it in the case notes. John, were you going to say something else?
Yeah, I think so. I think that if that's right on. I think that you have to do, you know, kind of your own assessments based on what are the core duties, right? And what is the safety training that is required to perform those duties. And if you have folks that are already going and the orientation satisfied that training, and you know, based on, you know, kind of your assessment, you don't think that there's anything else that they will need at this time, and I think that that's sufficient. And I would go back and I would just document that service in IWDs so we have our ducks in a row. You might want to just put a case note in, you know, just indicating, you know, that we're working out the details, and that's why it's recorded at this time, as opposed to, you know, when it occurred, that type of thing.
Okay.
As far as, I see a related question, I think in the chat, you know, and that brings a thought that, you know, safety training is something that can be ongoing, right? Certainly, I think at the outset, you need to make sure that before somebody starts the job, that they have all the information and skills to be effective, right? But, you know, as the job evolves, right? So as we go from, you know, fall to winter, you know, perhaps they, you know, especially, you know, like in maybe, you know, delivering meals, maybe there's, you know, other, you know, safety considerations around food handling that change on a, you know, seasonal basis. I don't know, it's not a great example, but you understand that as individuals' duties evolve and the environment changes, right? Because there could be a big change in COVID, and, you know, we learn new information and the guidelines around, you know, how to interact, perhaps that could change. We want to make sure that the employees are appropriately trained as the information becomes available as appropriate. Okay, so I see here, Patty, I think, Jill, I see another question around the COVID DRE has to do safety training. Does this apply to opioid DRE? Again, I think that you've got to link that back to, I think if it's a disaster recovery, I think from the guidance that we've been seeing, I think that they want to have that assurance. We can follow back with Tammy to be certain, but again, I think all the comments that we've noted are appropriate, and it may be that those individuals that you have placed have already had that safety training, and it's just a matter of documenting it for the customer record. Jill, I don't know if you have anything you want to add to that.
No, it's a matter of, again, with each position, whatever it is, looking at the job tasks, the function, what it is, the surrounding, the environment, and, you know, determine what's appropriate, provide that, put it in the case notes, and show the activity code.
Yeah.
Hi, this is Pilar with OES 7. John, thank you for answering my question. My question was about the work site, and your example is fine. Actually, I have meal delivery drivers, so I get it. But this is specifically, I had a bit of a bad connection when you were responding. Did you mention the service date, that part of my question? So I have places where they're doing the COVID training during orientation, and then some of them actually have more specific, not all of them, but some of them actually have very specific job related training, and it's on 2 different dates. And I just want to be able to give my agencies the correct information. What service date should they open up that safety DR?
Yeah. I think if there are if there's 2 distinct days that training is provided, I think you can open up the service. You can open and close that service on the same day, right? So if they had like an orientation at the beginning of October, and then maybe middle of the month they had like a work site, like a second day of training, I think you could open and close the same day service on that. That's a way to document it, and then just add any additional information in the case notes.
Okay, so I believe you're saying opening up that service twice is okay.
Yeah.
Okay.
Jill, you see any issue with that?
No, I agree 100%. That's what I would do. 2 separate entries, case notes to document what the different training was. What was it?
Thank you
Oh,
very
and I
much.
should say that in general, with the case notes for safety training, is to take just a minute and make us, drop a note in there about what it was. Other than just, safety training, is to just provide a little bit of information describing what it was. Thank you.
Thank you.
No problem. And Mike, I think I saw your question. I think we got that one as far as, again, just that safety training related to the occupation and the duties. Any other questions out there? No, we're coming up right at 2 o'clock here. Okay. Well, I know that I believe this webinar was recorded, and we'll send out information as to where it is posted. And I think our next steps is to complete our plan for and schedule for technical assistance, and we'll be reaching out to you, both Jill and Tammy and Deb, when we're ready to roll here. Jill and
John, can you hear me?
Deb, we can't hear you now. Okay, great. Yeah, please.
Yeah, at the end of the training, sorry. I posted in the chat pod my contact information, and I'm using my Illinois WorkNet email address for that. So if you guys need the email or call or whatever, that's my cell number and my work email address. But yeah, I'll be reaching out to once we get a little bit further along, I'll be reaching out to schedule the technical assistance visits and hopefully get that rolling.
Great.
But the other comment I was going to make was on the services. One of the things that kind of, especially on those same day services, if they're not open and closed on the same day, sometimes that kind of gets us sideways too. So if it is a same day service and they're doing the training, it's fine to open the 2 up. You just need to open and close it. Don't leave it hanging open.
Okay, great. Well, again, thank you all. Jill, do you have any last thoughts?
I appreciate everybody being on the call and look forward to getting this information out to you and getting started, because I know it is critical that we start off on the right foot with these. So thank you, everybody, for your participation, and we will be back in touch. And thanks, Deb, again, for your work on this.
Yes.
So, thank you all.
Thank you all. Have a great afternoon. We'll talk to you all soon.
Thank you.
Thanks. Bye, everybody.
Bye-bye.